All right, we are recording. And welcome everybody. All right, this is Lighten Your Load. I am Dr. Jen Horton, family doctor, now practicing functional integrative medicine after being in the mainstream world for 19 years. So thank you for joining me. We'll have some question time at the end and plan on about 30 minutes, maybe a little less. Here we go. Here we go. All right, just a disclaimer, this is for informational purposes only. Obviously, I'm not your physician. I can't give you medical advice. At the end, I will talk about if you would like to see me, how that could work. But please certainly consult your healthcare team before making any changes about medications, supplements, all that good stuff. Also, the literature on this changes rapidly, especially when I'm talking about some things with COVID. And a lot of the literature about the different supplements, we're making inferences from studying things like influenza and other viruses. So I can't say that anything exactly prevents, treats, or cures COVID, but my goal is to give you some tips to keep yourself strong and healthy during this time and going forward. So intentions for tonight's talk, I'm going to talk about what toxic load means and how to start looking at this in terms of what your individual toxic load could be. We're going to talk about how toxic load could affect your immune health. I'm going to describe the functional medicine paradigm and talk about how it brings together all of the components we should be looking at when it comes to our immune health. I'm going to break down briefly some of the building blocks of immunity in relation to COVID. A recent talk I heard by a microbiologist. We won't get in too deep here, but I just want to give you an overview of the difference in an immune system from somebody who gets COVID to somebody who does not, and talking about how we can maybe try to modify that proactively through lifestyle factors. And the last part that I just alluded to, looking at your personal lifestyle factors, to look at how we can just reduce our toxic load so we're not overloading our systems and our immune health potentially. So I just wanted to define functional medicine. It is becoming more popular, but a lot of people still don't know what it is. The Institute of Functional Medicine is a great resource if you want to dig into that further. But I love this definition. It's from Dr. Mark Hyman, and he's the director of functional medicine at the Cleveland Clinic. So he defines conventional medicine as the medicine of what disease, what pill. And that's how we're often trained. I'm trained to take your symptoms, make a differential diagnosis, rule out X, Y, Z. And often, the treatment plan involves a pharmaceutical, not always. And that's not necessarily bad. I'm not saying Western medicine doesn't have its place and its need, but when it comes to some of these deeper things that we're talking about, getting at root causes of problems, that's where functional medicine really shines. Functional medicine is a medicine of why. Why is a symptom occurring now? What is at the root cause? Why is somebody having stomach upset? Why does somebody have a rash? And could there be lifestyle factors or other things going on with somebody's physiology that we could try to shift or change before jumping right to a pharmaceutical? So when I see a patient for a functional medicine consult, again, I'm just kind of laying the groundwork here. We're reviewing a very detailed history. I'm putting together their concerns on a timeline. We're talking about different symptoms and fitting them into a big holistic picture is what I want you to get from this. But look at the bottom. And I know the slide's a little small, but look at the bottom. Sleep, relaxation, exercise, movement, nutrition, stress, and relationships. Those are the core of anybody's treatment plan. Now, do those things change overnight? No. I mean, sometimes people need support from a health coach or a nutritionist, but I want to emphasize that functional medicine is always looking at that foundation first before we're jumping to other remedies. So this is a key slide here. It describes what happens when we get sick. I titled it, How Your Body Falls Apart. And again, this lays the groundwork for why we have to look at the big picture when it comes to our immune system. And again, whether this be immune health, somebody's hormonal problems, somebody's digestive issues, this is a very key kind of system to look at when you're breaking those things down. It's very applicable to whatever the concern is. So I want to describe that purple bubble, body system 1. Basically, that's when we get stressed out. It's the fight or flight response that we've heard of, the I'm running away from the saber-toothed tiger physiology that has been with us from the beginning of time. The problem is in Western life, we're often in that saber-toothed tiger running away physiology all the time. And what happens is it starts to break down our bodies. It breaks down our nervous system. It breaks down our gut. It's just not a place to live and be healthy and be resilient. And often this is happening from a number of factors. What I listed those there, big life changes. I would argue that, an event like COVID-19 probably is going to be on that list. And that's my concern as a physician, is once we get over this initial period of social isolation or physical distancing, what are going to be the other implications of stress over these weeks and months? And what other health issues could this exposure to stress be causing us? So let's try to be proactive and get ahead of that and stop that from happening. So again, stress hormones are running high. It's adrenaline. It's there to protect us, but over time it's wearing our bodies down. So what happens over time when you're staying there? It starts to impact your gut. And believe it or not, 50 to 60% of your immune system is living in your gut. And there's a very important antibody there called secretory IgA. We'll just call it IgA for short. But basically, when your cortisol is running high, that antibody level starts to drop. And it's basically protecting my nose, the lining of my nose, the lining of my gut. It's that first line defense. So if you can think about it, if that first line defense antibody is being wiped away from those stress hormones, you're going to be at more risk for getting sick. And so this is where you hear this term leaky gut. People can start to have a breakdown in their gut lining where they're exposed to bacteria, viruses, fungi, parasites, a whole host of potentially pathogenic, bad causing things. So over time, your body likes to balance all of this out. Okay, we are creatures of homeostasis, and usually our bodies take care of ourselves in that way. Well, over time though, the stress hormones keep running high. We start to break down our gut. It starts to get leaky. Those toxins go through. Our liver and our detox systems become very overwhelmed. And that starts to cause a buildup of bad things coming in. It starts to manifest as inflammation in our body. And if there's one thing you can remember from functional medicine as well, is inflammation is at the root cause of most chronic disease processes and most things that harm us and cause disease. So what can we do about this? When I see a patient, this is the approach I'm taking. I'm looking at those 3 systems, but these are the diet and lifestyle things that you can be focusing on now. Again, looking at your stress hormones, how can we affect that? Number 1, eating a very clean diet, taking out the white flour, the sugar, the processed foods, things that raise inflammation in our bodies. Meditating. I meditate every day. I teach meditation classes and workshops. The science behind meditation, is solid. We know that it shrinks a part of our brain that makes us freak out. It increases the part of our brain that helps us with memory and focus and concentration. So that alone can be an amazing practice that can just shift your whole stress response and outlook. And I would say, spiritual and emotional health, it could be, again, meditation, it could be prayer, it could be community, it could be coming together with family members, albeit virtually at this time. Exercise and sleep is part of that. So there are a lot of lifestyle things that can affect that stress hormone level. Sometimes we're getting into some different supplements. I would only recommend that based on laboratory testing. Looking at the gut, again, often we're doing some laboratory testing here to find out exactly what's going on. But probiotics can support the gut. Again, a clean diet, eating a very Mediterranean plant-based diet, cutting out the sugar, the white flour, the processed foods. Thinking about, if you want to take a step further, looking at functional medicine labs and actually measuring what does your garden and your gut look like? What is that ratio of good and bad bacteria? I mean, that could give us a lot of helpful information. And lastly, looking at the liver detox pathways. You know, basically, if you clean up those first two things, there's going to be less for that system to clean up going forward. So I always like to talk about the four big types of stress, just to show that we have the ability to affect really all of these to some degree. Emotional stress is probably the one that comes to mind first. Sometimes that can be harder to address than some of the others, and sometimes, especially if there's a trauma history or deeper issues. But we definitely want to look at all of these. When I see a patient, we're addressing all four types of stress because they can all impact our health and that cascade that I just went through. Dietary stress, I alluded to that with sugar, you know, eating a very heavy animal diet in terms of non-organic meats can also be hard on the system. You just want your diet to be very clean and plant-based. Most of your diet should be plants. Anytime anybody has any pain, that's a sign of inflammation. That needs to be addressed. That can obviously contribute to stress as well. And lastly, the hidden inflammation. And that's the part when I'm working with somebody as a functional medicine physician, we're looking at labs to pick up these sources of hidden inflammation before they become pathologic. So really quick, this is a seminar I listened to about a week ago. Again, this scientist, Dr. Vajani, is studying how the different immune systems look from somebody who has COVID and somebody who does not. This is a very busy slide, but what I want you to get from this is on the left-hand side where it says no infection, to the right-hand side where it says serious infection. And basically, they're just finding there are various components of the immune system that are not working right when somebody has a serious infection. And the root causes often are things like toxins and chemicals. That's what we talk about when we say exposome, and I'll have a slide that describes that a little bit more later. But just think of the exposome as everything outside of you, and also kind of the leftover stuff, those toxins that are inside of you. And so people who are exposed to a lot of things and aren't regulating them properly are going to be at higher risk. And then he talked about that mucosal immunity. That's that secretory IgA antibody that I talked about that gets broken down when your stress levels are high. This is a picture that describes all these bubbles that we have control over when it comes to our immune health. You know, everybody always talks a lot about genetics, but, you know, probably 20% or less of your health is related to your genes. You know, your foodome, that's just the bubble of everything that you're consuming. I mean, think about when you eat. You have a choice to eat something that's going to bring nourishment or something that's going to tear down your body or bring inflammation. I mean, that's in our control. Looking at that gut microbiome, how can we take care of that garden that takes care of us and modulates our immune system? The exposome, again, those are all those toxins are around us and then what's in us. Again, sometimes that gets overwhelming as to what we can do on a day-to-day basis, but I'm going to give you some simple suggestions in the next slide. The immunome, all that means is what is kind of that soup of your immune system. And again, all of these things affect how your immune system is working. So if we can just cut down the stress levels, cut down the inflammation levels, we're going to have a positive impact on your immune system. And ultimately, all that's going to affect whether a virus, you know, even gets into our body, and if it gets into our body, how much damage it's going to do. This is a picture of that exposome concept, and the idea is these are all of, again, the outside factors that contribute to our health. You know, pollution, your diet, medications, infections, inflammation, gut flora problems. Xenobiotics are basically anything that acts like estrogen in our body, which unfortunately that can be a lot of chemicals that we're exposed to in cleaning products, in personal care products, in medications, in pesticides, herbicides, etc. This is just a study that just alluded to, you know, how many people die because of problems and pollution related to air, water, and soil, and how we need to be looking at this chemical soup that we're living in a little bit more detail when it comes to public health. This is just a shout out to personal care products. I think some women are on top of this, and men too, but I think women, because we tend to use more stuff, we just can be more exposed to things. So again, this is from the Environmental Working Group, but the average woman uses at least 12 personal care products daily, exposing us to about 168 chemicals a day. And again, maybe in small amounts, these are quote safe, but it's just the years and years and years, and the fact that you're putting them on your skin and they're getting absorbed into our body, and they often stay in fat tissue where they can just stay with us for many years. That's where we get into the concern for harm. Again, looking at what's in your cabinets. This is another crazy stat that the FDA just does not do any pre-market testing, require any pre-market testing or approval before cosmetics and personal care products are released. And it's very hard to even take something off the market once it's been released. So the European Union has banned 1,300 chemicals found in cosmetics, and we've only banned 8. So there's definitely some room for improvement in this category. And if you've not taken a look at your medicine cabinet and what you're using on your body on a daily basis, this is where you have the power to cut down on that toxic load coming into your body. And this is just from that scientist where he talked about all the people who were exposed to, again, the pollution and the water and the soil, et cetera, tended to have a lot of autoimmune problems, fibromyalgia, chronic pain, a lot of complicated medical diagnoses. Another busy slide, but what I want you to remember from this is, see that mucosal immunity and that SIG-A, again, that is what directly goes down when our stress hormone levels are going up, and you don't want that to happen when we're trying to protect something from coming into our bodies. Again, Secretary IGA, just think of it as Homeland Security. It needs to be there on those layers to keep everything tight and strong and to keep the bad guys out. And this is just a picture version of the same concept. Basically what this is showing is on the very top, you see all those kind of Y-looking things that are stuck together. Those are those Secretary IgA antibodies, and they're up there trying to kind of make sure all of that garbage goes right on through the GI tract. You don't want it to seep down in between those green-looking columns. Those are the cells in your intestine. And that's just a bigger version of it, showing how Secretary IgA would remove something such as a coronavirus, but other things as well, and take it on through the GI tract. Same picture here. And this is just showing what happens as the Secretary IgA levels go lower. If you look from left to right, basically what's happening is you have less of those antibodies, and now you see those viruses are starting to go down. They're starting to get into the circulation, into the cells where you don't want them to be. And this is just a picture of how the virus attaches to our cells. Basically, it wants to get inside of our cells so it can take over our nucleus and then create more copies. Again, you don't want that to happen. And by supporting our immune system, we can prevent this from happening, is the goal. Same picture, same picture. Again, just a shout out to the balance of the immune system. We want a healthy amount of various types of cells. And this is the cytokine storm that has been discussed a lot. I mean, when people die of COVID, it's because of this most often. Basically, it's an inflammatory response that's gone haywire. And so they're studying why this is happening, and why is it that some people have an inflammatory response that goes off the tracks and some people who don't. And this is definitely more to come on this, but that scientist who I alluded to earlier, that's exactly what he's studying, is what parts of those immune system could we modify to prevent this from happening. This is a slide that I can send to you after the presentation, but basically it just breaks down the different types of immune cells and the different lifestyle things, some of the different supplements that have been shown to support those areas. And I just want you to kind of step back and look at the commonality here. I mean, it's the flavonoids, that's your plants. That's, you know, eating the rainbow. Vitamin C, is another one. I mean, they have used IV vitamin C for critical patients. That's been reported in China and in New York as well. Vitamin D, an important hormone that most people, when I have checked levels in clinical practice, tend to be on the very low end of normal. So most people probably should be taking that. Stress reduction on the far left, and that's a shout out to those cortisol levels we talked about earlier. Probiotics and fiber to support that gut lining. It's really important to get probiotics and prebiotics so you feed that healthy bacteria so that they can do their jobs to protect us. This is an excellent resource from the Institute of Functional Medicine that summarizes the kind of state of botanicals and supplements when it comes to immune health support. Again, nothing that they can say is used specifically for COVID-19, but a good overview of the literature in this area. And their website is ifm.org. So quick summary, obviously you're gonna follow the social distancing measures as long as they're in place. You're gonna wash your hands, but you're gonna look at the diet, eating the rainbow, cutting out sugar, looking at alcohol as that can lower our immune system as well, eating things like onions, garlic, turmeric, ginger that all have anti-inflammatory properties, moving your body daily, sleeping at least 7 to 9 hours of sleep. Your body must rejuvenate, especially now. I cannot overemphasize the importance of sleep enough. Definitely, if you haven't thought about meditating, I would definitely start researching that. I love to use essential oils as tools to support my relaxation response. Again, anything we can do to lower cortisol levels, and just not being afraid to reach out with people in different ways. I think we have to get more creative nowadays, but we must maintain social connection somehow, because that in and of itself is a major risk factor for poor health. And lastly, if you really want to dig into what is going on with that stress system, with your gut, with your liver detox, then we personalize things further by looking at some labs so we know what is going on in your personal physiology. We know where your hot spots are, so to speak, where your inflammation is, so we can do as much as we can with lifestyle, and sometimes use supplements, medical grade supplements for short times to kind of correct those changes that we're seeing. And lastly, I am working through Calm Spirit Acupuncture in Arvada and Golden. And right now we are doing virtual immune health consults, and you can see me and or one of the acupuncturists virtually. If you do the combination consult, we'll consult together and kind of balance the East meets West approach to your immune health. Thank you so much. I will pause the recording here and see if you guys have any questions.